いらっしゃいませ.
Hear that? That's me in Tokyo learning to make sushi from a master. How did I get here? I invested wisely. Now the only thing I worry about is using too much wasabi. Get where you're going with SPY, the world's most traded ETF. Getting there starts here with State Street Investment Management.
Before investing, consider the fund's investment objectives, risks, charges, and expenses. Visit statestreet.com/IM for prospectus containing this and other information. Read it carefully. SPY is subject to risks similar to those of stocks. All ETFs are subject to risk, including possible loss of principal. Alps Distributors, Inc. Distributor.
Happy holidays! Want to give your host a gift? Consider subscribing, rating, and reviewing the show this holiday season. It really helps the show grow. From all of us at Believe, have a Merry Christmas, everyone, and a Happy Holiday.
What a massive day in obesity medicine news. A pill that rivals injectable weight loss results has been approved by the FDA, the first ever GLP-1 pill, and it's going to be on pharmacy shelves in just a couple of weeks, not months. This isn't something we're talking about far off. We're talking about a couple of weeks away. This is an absolute game changer for obesity medicine, and we're going to get into it this week on the Weekly Dose podcast. Let's do it.
Welcome to the On the Pen podcast with your host, Dave Knapp.
Welcome back to the Weekly Dose podcast, your one-stop shop for obesity medicine news from the patient perspective. We spend our entire life work here at On the Pen devoted to providing you with information that empowers you to have better conversations with your doctor and hopefully better health outcomes. And we cover the weekly news every Tuesday. Our podcast drops here, the Weekly Dose podcast, and that's what you're listening to today. So whether you're listening on YouTube or listening on Spotify or Apple, please drop it a 5-star rating and review on the podcast platforms. And if you're watching on YouTube, please make sure that you subscribe to the channel and hit the bell for notifications, because this is the type of news that we've been bringing for 3 years now, the most trusted voice in patient-centric obesity medicine news. We reach several million patients or potential patients every single month through our On the Pen platforms. And I would just like to welcome you if this is the first time that you're here to our Weekly Dose podcast. And for those of you who have been hanging around for a while, a heartfelt thank you, as this is the last podcast of 2025, right? We will be back after the new year with the podcast. But I want to thank you, because not only are we one of the top-ranked medical podcasts in the entire world, we're consistently in the top 20. And we're there because you choose to drop 5-star rating and reviews on the podcast. You choose to download it every week. You choose to listen. If you're on YouTube, you choose to engage in the content and subscribe. All of those things help to elevate this podcast. And we are not even close to finish. We have an amazing year ahead of us. We've made some pretty big announcements in terms of our acquisition of a building that's going to allow us to film additional types of content in 2026. I am so excited for the future of On the Pen, and just wanted to say a heartfelt thank you to those of you who have helped to build this into what it is today. And if you're new, I want to welcome you, because you deserve to treat the chronic disease of obesity. And there are a whole host of options out there that you can talk to your doctor about. And I hope that, like the many millions before you, you will trust us as a voice to help lead that conversation and educate you as you advocate for yourself and for your health. But the breaking news this week, and this is where we're going to spend most of our news this week, is in the first ever GLP-1 pill to be approved by the FDA for chronic weight management. Now, you may have known the diabetes version of this pill as Rybelsus. It has a list price of around $1,100. But the amazing thing about the Wegovy pill, which is what the FDA just approved, it goes up a little over 2 times the dose strength of Rybelsus, and patients using the 25 milligram dose of the oral Wegovy taken once daily in the morning on an empty stomach, patients lost the same amount of weight on that pill as they did the 2.4 milligram injectable version of Wegovy, the once weekly version. So we're talking about efficacy that is right on par, not close to, but right on par with the injectable version in the safe package of a peptide, the delivery system of a peptide using the SNAC technology from Novo Nordisk. Again, this pill has been on the market for several years in the diabetes form, but just now has been approved for weight loss. So what I'm really excited for is not only the efficacy, but the proven safety we have in the real world of this medication. So a couple of points that I want to really highlight this week in terms of what this means for patients. So let's talk about what this means for patients. The pill works like 2.4 milligram injectable. You take it once daily, 25 milligrams is the highest dose. You titrate up from 1.5 milligrams and follow that titration process in a monthly manner, typically along with the OASIS trials. Now, one of the interesting things to note about the titration process is it takes a little while to get up to that top dose of oral semaglutide. So it's going to be days 1 through 30 at 1.5 milligrams, which is a very low dose. Days 31 through 60, you're going to titrate up to 4 milligrams. Again, that's if your doctor's following this protocol. Days 61 through 90, you're going to go up to 9 milligrams. And then day 91 and onward, till you reach your goal, you're going to be at the 25 milligram dose, the top dose of oral Wegovy. Now, what's interesting for patients that are already maybe on the 2.4 milligram dose of the injectable and want to switch to the oral version, because price is a factor here. The cost of this medication, especially if you're looking at maintenance, is very, very respectable when you consider that Rybelsus was $1,100 a month list price. Wegovy is going to start oral at $149 for the 1.5 milligram dose, and then it's going to tier up to around $399 was, I think, the last number that I checked. $399 for a month for the top dose. Now, if you require the lower doses, you're going to be able to maintain at a lower price than that per month. So if you're looking at this, just know that if you're already stable on the 2.4 milligram injectable, there's clear clinical rationale to talk to your doctor about transitioning to a higher dose of the oral version. Because it's the same molecule, because it's comparable exposure, and because it's the same exact mechanism as the injection, you should be able to argue a continuity of care, not a total reset on going back to the 1.5 milligram. So talk to your doctor about that. If you're on the 2.4 and you're looking to switch to the oral version, there is, I think, a strong rationale to have your doctor look at titrating, not following that really slow titration process. Now, one of the things that I think is super important to note about this launch of oral Wegovy is that the stage is set for a January launch. We're talking about just a couple of weeks away. So we're not talking about a drug that is extremely far off. A lot of times when we're talking about future medications on this channel, and maybe this is just the nature of when we got into this 3 years ago, everything we talk about seems like it's so far in the future, it almost feels far-fetched, like, oh, that'll be great one day. Well, I really feel in many ways like this is the first one day. Like, we've hit a real milestone today in terms of a pill version of these injectables that reaches the efficacy level of the injectable versions. So what's amazing about this is that the timing is really great for patients who need more options because maybe your insurance has dropped coverage for the injectable versions that you're on. Maybe there are maintenance considerations that you've had in terms of what options would you use for maintenance, and maybe you're right there. I know there's so many in the community that have been on the injectable versions for such a long time. This is another tool in the arsenal. So right when people are looking for more sustainable long-term options, especially if you're looking to save and you don't have coverage, this is going to be a great option. So this is not something theoretical or pie in the sky or far-fetched or way off in the timeline of obesity medicine. It's here. It's right around the corner in January. So let's talk about a couple other things. But before we do get into the rest of this amazing news, I want to thank our sponsor. Our headline sponsor of the podcast is Shed. And you can check them out by going to tryshed.com. And you can learn all about the different options that they have in terms of medications that treat obesity, the disease of obesity. There's a lot that they offer in terms of longevity and just optimizing your total overall health. But the main thing is they're going to give you access to a prescriber, and you're going to be able to sit down and have a conversation about your health. And you're going to have the ability to get connected to treatments that make sense for your specific situation. And you're going to be able to get access to branded names if that's matches your financial situation and your insurance situation. And they're also tied into one of our favorite compound pharmacies, Strive Pharmacy, in terms of compounded options. Whatever you're talking to your doctor about, Shed is the company that we trust to help guide you there. You can use code OTP25 and save 25%. They are the ones that are allowing us to do this full time and bring you the news as it breaks. So at a minimum, make sure you let Shed know that you appreciate them sponsoring the On the Pen podcast whenever you see their posts around social media. So thank you, Shed, for your continued support of the On the Pen podcast. Let's talk a little bit about why I think that the Novo pill launch is such a big deal in terms of the obesity medicine space and where we're at. There's been a lot of talk, including on our channel, about Lilly's new drug that is launching right on the heels of this pill. We'll get another pill from Eli Lilly, and that pill is called orforglipron. Now, notice that every medication that we talk about in terms of the new advancements in obesity medicine ends in the suffix tide. So whether we're talking about tirzepatide, semaglutide, liraglutide, dulaglutide, exenatide, you get the point. Retatrutide. People I trigger the entire internet when I say retatrutide. That's literally the way that Eli Lilly says it, so I've kind of adopted that. But if you've been following this channel, if you're an OG, put retatrutide in the comments, because we've literally been talking about it for 3 years. It's crazy to be one of the first people to talk about something and then to fast forward on the timeline a little bit and just have the whole world talking about it. And I feel like, again, when I talk about this moment in obesity medicine with the launch of the first GLP-1 pill, it's just sort of one of those moments where, again, you talk about this stuff and it almost seems far-fetched or unreal that we could get to a day where it's reality. But we're getting closer with retatrutide too. For some of you in the research world, you're already there, right? And you have stories of your own to tell. But I digress. What I love about the Wegovy pill is that it is a GLP-1 peptide. It's semaglutide. It's the same thing that people have been taking from an injectable version. They wrap it up in a technology that allows that peptide to survive your stomach acid and then be absorbed by your body. The orforglipron pill is a small molecule pill. And while the small molecule pill of orforglipron will be much easier for Lilly to manufacture compared to manufacturing this amount of active pharmaceutical ingredient, some of the things that people don't understand about semaglutide is that it's made from a recombinant-based yeast-based process where essentially you have this yeasty brew where I always like to think of it as a GLP-1 beer, but they extract the protein from this yeasty brew, and that protein is ultimately what becomes that active protein, the long chain of amino acids that is semaglutide. Now, that is unique. How they make that version of semaglutide is unique and very, very labor intensive. But what you get as a patient out of that is a extremely safe option to take in terms of what the clinical data has shown us and what now years and years and years of real world data, post-marketing data, they call it. That's when they basically look at electronic health records and just say how many people have been on this and what kind of things have popped up in the real world that didn't pop up in clinical trials. And we get that safety level. Now, Lilly acquired the intellectual property of orforglipron a few years ago. I think it was from a Chinese company. In this small molecule world. And my hesitancy about that is twofold. You have seen other companies try and fail with the small molecule GLP-1s because there is liver safety issues. Now, we have not seen data that would point to orforglipron having the same thing. There have been some minor little blips in their studies of really high liver enzymes. But my concern in the real world is now that I've led a community of people living with obesity who have used these treatments in the real world, I know darn well that people get these medications in the real world, and what do? Well, they're desperate, and the drug eventually stops working as well as it once did, and they just take more of it. I'm not condoning that. I'm just a realist, and I know that that's what people are doing with these medications every day, and I can get concerned because orforglipron, when it hits the market, doesn't touch or hold a candle to the injectable versions from a weight loss standpoint. I think it gets about to 11% at the highest dose. And even in the phase 3 clinical trials, Lilly pulled back on the highest dose of orforglipron, and I think it was because they were concerned about those potential hepatic liver safety issues. And so what happens in the real world if you take more of a small molecule GLP-1 that is metabolized by your body in a different way? I'm concerned about that one, because it's not as powerful and it has the capacity for people, trying to get more efficacy out of it than it was intended for. And that's not to say that that's Lilly's fault, but I just see it happening in the real world because that's what we've seen with even the injectable versions, which are so much more powerful than orforglipron. And I think that's what, bringing the conversation back, I think that's what makes oral Wegovy so exciting is it's a peptide. It's a peptide. It's just, we've got so much real world data on these and the safety of these to get the efficacy of a oral peptide that we've gotten out of the injectable versions. It's just astounding. And it's such an exciting day for patients. So Novo actually chose the harder path here. They chose the peptide path rather than the small molecule, even though it's harder to scale, even though it's harder to formulate orally. In fact, they paid around $2 billion for the technology alone to be able to wrap the peptide up and make it survive your stomach acid. So we're talking about massive investments that Novo made just to bring an oral peptide to the market. But the safety profile is proven. And that matters when you're on a therapy that you're probably going to have to be on for your whole life. That's what all the data has pointed to over the last few years when we look at people going off these medications. Now, we have been covering for a couple years, including several interviews with the CEO of a company called Fractal Health, which may help you maintain your weight loss with a GLP with a simple outpatient procedure, but it's not here yet. So if you're looking at being on one of these drugs for a long, long time, safety matters. Safety really, really matters. So I applaud Novo Nordisk in their decision to stick with the peptide version. And I have to say, if I'm just being honest, again, I'm just a dude on the internet. I'm just a patient who's also living with obesity and trying to be around longer for my kids. If somebody were to come to me and they were to say, Dave, which oral option should we consider? Because we're not going to do the injectable. We're just going to do the pill form. Which one should I talk to my doctor about? 10 times out of 10, I would say Wegovy. There's just too many questions that I have personally, just being somebody who's very close to this, about orforglipron. Plus, 16% weight loss with the high dose of Wegovy over 62 weeks versus 11% with orforglipron. So it's just a better drug. You could argue that orforglipron is easier to take. You don't have to worry about the empty stomach. It's the non-peptide. Maybe. You do you, boo. If you disagree with me, you do you, boo. Put it in the comments. I'm eager to hear what your take on it is. But as somebody who's followed this for very, very obsessively for multiple years, I would say 10 out of 10 times, I would say oral Wegovy would be the way to go. So cost, we kind of touched on this a little bit earlier, but today, Rybelsus, the diabetes version of this drug, its list price is $1,100. So that's the closest thing that we have to compare this. Now, contrast that with the information that we got a few months ago, or it's probably been a few weeks ago, is probably better said. But the MFN pricing, the most favored nation pricing, that's the direct cash pay price that you'll be able to get these medications through NovoCare, is $149 for the starting dose. $149 for the starting dose, and around $399 for the highest dose. So we're not talking about incremental price differences for an absolute game-changing drug. This is access changing. This is a big deal for people, because this is one of the most important parts of this entire story about the oral options, is that we're getting them for so much cheaper than they were just a couple of years ago in the diabetes version. This just doesn't, it's unheard of. This doesn't happen. There's been so much innovation in the space in terms of pharmaceutical companies moving around the PBMs. And there's a lot of debate to be had about this. Like, do we really want pharmaceutical companies to have this much power? And do we really want to have to go directly to them to get our medicine? And what does that do to independent pharmacies? There's a lot of conversations I have. But when we're strictly just talking about access to obesity medicine, which is what we're focused on here at OnThePen, you have to just be amazed that we're looking at these drugs that can change the game, that for many people are already proving to be affordable. I mean, you look no further than how many people are willing to pay $500 a month for Zepbound. I mean, it's still, is the price still too high? Yes. I mean, I'm not cheerleading high drug prices, but I am also somebody who is a realist, and it is astounding to me that we're able to get these drugs that are going to extend our life for the price that we're getting, compared to what, say, my wife has to pay for her rheumatoid arthritis medication. If she stops taking that, her body just decays. I mean, it falls apart. It eats itself. That medication she's on costs us at least $5,000 a month without insurance. So the fact that we live in a world where we can stop the chronic disease of obesity dead in its tracks with these medications for $500 a month and not $5,000 a month is pretty amazing to me. We got a long way to go, though. We got a long way to go, because if you look at, the Oasis trial, I think it was like 62 weeks. I mean, if you look at $399 for over 62 weeks, if that's what you're paying, you're talking about like $25,000, and then you have to maintain that with the medicine, going by the numbers. It's still too much money, but it is amazing compared to where we were. And right? I mean, isn't it? Isn't it better compared to where we were? I mean, I guess that's the only statement that I'm trying to make, is it's pretty amazing where we were just 2 years ago with these drugs and the pricing, and where we are today. We still have more to go to make these more affordable. But if we're to believe what's going on with most favored nations, all of these medications should be $250 in the next 24 months, which would be amazing if that happens. Will it happen? I don't know. I'm skeptical. I'm hopeful, though. And I can't help but be optimistic about this, because so many people in our community are getting their life back from these medications. So the orals are a big deal. Obviously, they're coming just around the corner in the next couple of weeks, and I'm super excited for you. If you're going to be trying it, let me know in the comments. I'm really curious about talking to my doctor about the potential of maybe doing a low dose of semaglutide in addition to my weekly injection of tirzepatide. I wonder if my doctor would be open to that, because that is something that I'm super curious about trying. Have you guys thought about that? There's benefits, I think, to the GLP-1 molecule that we have not been proven so far with GIP. And so I wonder about that. I will definitely be talking to my doctor about that because I'm curious about it. Curious to know in the comments of this video if you're curious about that as well. And if you're a provider, what are your thoughts on it? Not that that's medical advice, but curious what your thoughts are if you're a medical provider prescribing these medications. Now, the last thing I want to touch on, and we're not going to spend a lot of time on this, but we did get an announcement yesterday, and I did a video on this, so go back and check out our YouTube channel, or you can check out our Substack at obesity.news. But we did get word yesterday on the Zepbound savings card extension for 2026, and we also got word that the Mounjaro savings card has been extended both through the end of 2026. We do not have details on the Mounjaro savings card, but a real quick flyover of the Zepbound savings card is essentially if you have commercial insurance, you have to have commercial insurance to qualify for these savings cards. You can't be on Medicare, Medicaid, TRICARE, and really that's all legal reasons why you cannot be, because pharmaceutical companies have rules against promoting their drugs and advertising their drugs to those patients. However, if you have commercial insurance but you do not have coverage for Zepbound, you'll be able to get the pens for $499 a month with the savings card. Okay, they extended the caps. They increased the caps monthly and increased the annual caps to make it so most of you will pay $499 a month for the pens. Now, that obviously pushes a lot of you to the single dose vials and outside of your insurance, because if you go to Lilly Direct and circumvent the entire insurance process altogether, your doctor can write a prescription to Lilly Direct, and you can get the 2.5 milligram vials for $300. You can get the 5 milligram dose for $400, and you can get all of the other doses for $450. So obviously, if you're on the upper doses, you're saving yourself $50 a month to get the direct pay vials instead of using the savings card. And if you're only on the 5 milligram or the 2.5, you're saving even more. And so it's pushing a lot of those folks who have insurance coverage to the vial options. Vial option makes it sound terrible and disgusting. The single dose vial options. And so, a lot of you will be making that move. I'm curious to know if you're in that camp. Will you be moving to the vials, or are the pens worth that extra $50 per month? I think most people would say, I'm just going to the vials. Now, for those who have insurance coverage that does cover Zepbound, there was a tweak as well. You were used to paying your copay minus $150. So the savings card was covering $150 worth of your copay. So it's important to know what your copay is on this medication, because that's how you're going to figure out how much you're going to pay for the medication in the coming year, because they're only going to cover $100 worth of your copay this upcoming year with the new savings card. Why is that? Well, it's the natural progression of these savings cards. They're all to get people on the medication while insurance adopts the medication. Now, with the movement of the single dose vials and the cash pay option, that's sort of been Lilly's answer to insurance companies not picking these up the way that they should and covering them the way they should for the games that they play with the rebates. So one could argue they haven't accomplished their goal of getting insurance companies to play ball, but they have gone around that by offering the cash pay options. So they are lowering the coverage of the card to $100 instead of $150 per month. The annual caps went down, obviously, in correlation to that. So if your copay every month from your insurance is $250 for Zepbound, this past year you've been paying $100 because the savings card picked up $150. In 2026, your savings card is only going to pick up $100. So if your copay is $250, you're going to pay $150. So you'll see a $50 increase in your in your monthly fill of Zepbound. Both of these savings cards automatically update to the new version on January 1, and both of these savings cards go through the end of December in 2026. So that's the information that you need to know on that savings card side. And I hope that information is valuable to you as you sit down and discuss this with your doctor for the upcoming year. That's the news that we got for this week. I want to say on a personal note, thank you again for helping to help us reach new heights in this past year. I cannot wait for 2026. It's going to be another banner year for patients living with obesity. More good news is going to continue to roll out. More accessibility is coming in 2026. More things from OnThePen are coming in 2026. And I can't wait to do it with all of you. Thank you for giving me this platform. And thank you for being such loyal and devoted followers of OnThePen. Want to wish you a very Merry Christmas to those who celebrate. It's one of the most special times of the year for me and my family, so thank you for giving me some time to enjoy it with them. You all mean the world to me. I am so grateful for all of you. Thank you for being here, and thank you for being the best part of On the Pen. We will see you in 2026.
Happy holidays. Want to give your host a gift? Consider subscribing, rating, and reviewing the show this holiday season. It really helps the show grow. From all of us at Believe, have a Merry Christmas, everyone, and a happy holiday. If you like the show, please take a moment to rate, review, and subscribe. It really does help the show to grow. Thank you for listening.